very good evening and welcome to yet another edition of the program Times Exclusive here on Times Network. My name is Banda, thanking you for joining us in this edition this week of the program. Tonight I'm joined by Dr. Dan Namarika. He's the Principal Secretary for the Ministry of Health.
I love brilliant green on my walls. I love signal red, sweet lime, electric blue. I just love golden yellow.
You get all that and more at Rainbow Paints. Imagine a water-based paint that is water-resistant. Imagine a paint that is absolutely washable to remove dirt. And it guarantees you 10,000 cleaning scrubs over its lifespan without losing its luster. There can only be one paint that does just that, and that paint is acrylic sheen. Get yours today at all leading hardware stores. Rainbow Paints. Peace of mind. Part of the deal.
Dr. Dan Namarika, we are not shaking hands tonight.
Indeed.
But thank you very much for joining us tonight in this program.
No, thank you for inviting me to this very important program.
I presume you do watch this program at home.
Indeed, quite a number of times when time allows, I'm a participant and a listener to that.
Very briefly, if you may sum it in few words, who is Dr. Dan Namarika?
So Dan Namarika is a second born of Pastor Namarika. He's living, my dad is living, he's now 79 years old. And my mom is also living, she's 72 years old. And so I cherish that both my parents are living. Married to Jesse Mlota Namarika. And by God's grace, she's a doctor, a dental surgeon at Kamu Central Hospital. And both her parents are also living. They're not in Malawi, so we are really protected by these four parents. We have two children, a boy and a girl, Chitsanzo and Irene. So that's basically me.
How long have you been in practice?
In practice, I graduated. By the way, we were the first group of students to have done 100% of our training in Malawi. So when College of Medicine was being opened with the very first group, direct from Chancellor College or universities within Malawi, we were that group. So that was in 1994 that we got selected from Chancellor College to start our training at College of Medicine. In our class, we enrolled 30 students, but at the end of the training, only 18 graduated. So quite significant attrition.
Yeah.
Yes.
It's a difficult course, medicine.
It is. It requires discipline. There's a lot to read, a lot to learn within a short period of time. Requires a lot of discipline. Having studied at Chancellor College myself, I would compare some of the books that we were reading, would have been reading maybe in our fourth year, and they were being used here maybe earlier than that. And so the discipline part is really, really critical. And at the time that we were starting, we didn't have many people that would also be role models or take us through the process. Here you are, you have to go into a cadaver. A cadaver is a dead body that you need to dissect and learn.
You didn't have that?
We didn't. Oh, we had the first body that was taken from Tanzania.
Okay.
From Tanzania.
Of a real human being?
Real human being.
Okay.
Taken from Tanzania, brought into College of Medicine. And we were, in fact, I was one of the very first group students that were requested to do the first dissection on that body. And so it was, you'd imagine that some people would not feel comfortable. Others would say, well, after this, I'll never eat meat again. And so that was the time that, like our guinea pigs, in that challenging system.
Yeah. So you specialize in what?
My area of specialty is internal medicine.
Internal medicine.
Internal medicine.
Okay.
So after doing my first degree, that is 5 years course at College of Medicine. We do another 18 months or so of internship. After internship, then you can either go to become a medical officer. So I did that 2 years at Kamu Central Hospital before I went further to South Africa to do 4 years of postgraduate training at Wits University.
Sponsored by Malawi government?
No, I wasn't sponsored by Malawi government. I was working for Malawi government, but I was sponsored by University of North Carolina, Chapel Hill. University of North Carolina is doing research at Kamu Central Hospital and a few places, and it's also informing policy in Malawi. They are also contributing, by the way, they're contributing to our cancer center in terms of diagnostics. So they've trained quite a number of Malawians, but I should thank them because I was probably one of the very first Malawians to benefit from a scholarship, a 4-year scholarship.
So even when you came back from South Africa, you were still working.
Still, they didn't take me to the institution. They still said, "We want you to work for Malawi government."
You could have left.
I would have joined them.
Okay.
Because they would have been paying me much better monies. But they said, no, we want you to contribute to Malawi government. The current short stay ward at Kamu Central Hospital, we did it together with University of North Carolina. The current cancer center, the thinking, of course, there are other players that were there behind, but they contributed to our treatment modalities at Kamu Central Hospital in the early days. When I just returned from school, they were providing medicines, they were providing their nurses when we treated some of our very first patients in one of the smaller rooms at Kamu Central Hospital, specifically Ward 2B, when we were treating those patients. So UNC, or University of North Carolina, has been a part of my life, if I were to say, contributing to but also, let me just mention,
yes,
people who have not known this thing, the issue around antiretroviral therapy in Malawi. Initially, you remember that people were paying for medicines for antiretroviral drugs.
Yeah.
They were paying 2,500 kwacha. And I remember at that time, as a medical doctor, my salary could not have afforded me a month supply of antiretroviral therapy. That was way back in maybe 1997, 98. And I was privileged. I was privileged to be one of the very first doctors to work in the paying ART clinic, antiretroviral therapy clinic, at Kamu Central Hospital with Dr. Luftil. Whereas in Banda there was Professor Wirima and Dr. Mungui Nyirenda, whom you may know. Those were the pioneers really of antiretroviral therapy, and said this can work even in a poor environment like Malawi. Without too many protocols, we can do that. And I was also privileged that I was sent by Malawi government to Geneva, to WHO, way back, I think that was around 2000, to make a presentation on that clinic, that antiretroviral clinic, that this thing is possible and it can be done even in poor countries. In the meeting at WHO, from Africa, there was Malawi, Uganda, Botswana, but we had representation from Brazil, from Thailand, across the globe. That informed the World Health Organization that it is possible to have antiretroviral therapy being given to a large scale. So that was one of my contributions.
Still
with government.
But people paying.
At that time, people were paying. So they were learning from the paying clinic.
Okay.
Learning from the paying clinic and saying, but is this something that can then be rolled out on a large scale? And that was before the Global Fund.
Okay.
That was before the PEPFAR. So they were saying, they're learning cases, and one is Malawi.
A qualified doctor doing a terrific job at Kamu Central Hospital, why, when others are leaving the country, or were leaving the country at that particular time, why did you decide to stay?
No,
you would have gotten bigger monies, as you put it, elsewhere.
No, in fact, when I was in South Africa, I had a job provided to me to Canada. And remember that here I am being offered a job in Canada. By the way, my wife, Jesse, the parents are in Canada.
Okay.
It would have been easy transition just to move. My wife, the family is in
their
Canada.
bongos is already there.
They're already there.
Yeah.
And most of our siblings, by the way, they are like 10, 11 children, and 8 of them are already in Canada or America.
Okay.
So they're Malawians.
Yeah.
But we could have easily trekked out and say, this is already home for us. Let's just move out to Canada. But the first thing that I need to mention here is that Jessie herself is a motivation to me, because she would easily have studied with her family.
Yeah.
She chose to come back to Malawi, and she's diligently working for government. She doesn't work for any private facility other than government or College of Medicine.
Oh yeah.
Every day, that's what she thinks is government, and so she's been a model, and she's been a big support to me. She may not have noticed this, but I should say that my success is her success.
Here you are now, the most powerful person in the Ministry of Health, the principal secretary. It's not a small position. You are the big boss there. How did it happen?
Well, in health, we don't call ourselves bosses. We call ourselves junior or senior colleagues.
Or senior colleagues? Eh?
Yes.
Okay. So not bosses?
We know not bosses, because the issue is the success of health is a team. So if, depending on who is there, then you deliver. There's no way a doctor, any smart doctor, will succeed if the nursing team behind them are not doing the right things. Even if the cleaner is not making the environment clean, because issues of infection prevention would start with the cleaner. Okay. So you need so that's why I'm saying the no bosses is senior, junior, and senior colleagues. I still see it that I talked to you about the HIV issues. Mm-hmm. I think we're going that direction. Do you know how many people were dying when I was an intern in my ward at Kamusen Hospital? There was a day that we had 11 deaths. 11
HIV
deaths.
related.
HIV related.
Yeah.
Yes. So I've seen it. In fact, one thing that you're there, Brian, you know what motivated me to go into medicine was HIV.
Okay.
I wanted to be an engineer, an architect, but I watched this movie by a Ugandan musician, Phil Lutaya, who returned from Switzerland. He was doing very well in Switzerland, but he contracted HIV. But he changed the narrative in Uganda, and that's why Uganda moved so fast to appreciate and accept HIV. And I'm bringing HIV in relation to the coronavirus.
Yeah, and that's
so much denial.
Yeah, and that's where our discussion is going now. I'm glad that you have pushed it direct into corona.
Yes,
let's talk about it.
Because there was a denial with HIV. And you remember this, even in Malawi, that we used to deny HIV. Even in funerals, people never spoke about HIV, that this has died of HIV. Even today, if you're filling the death certificate, do you indicate that this person has HIV in the background? It's still denial to some extent. And
so as a doctor, you can't write it? That this gentleman or this lady has died?
I've promoted that. Mm-hmm. But if it was your relative, would you be happy that on the death certificate I've written HIV positive? Would you be okay that, yes, this is your relative that has died, and on the death certificate I've also written that, yes, there was pneumonia or TB underlying HIV? Would you be happy? And nature of such diseases, HIV and coronavirus, immediately there's that distance. That's what promotes denial and promotes stigma.
How big a challenge is COVID-19?
COVID is big. COVID is big, and the thing about COVID is that it is rapidly moving. This disease is only 5-6 months old globally. It's 5-6 months old, unlike HIV. The first case that we diagnosed of HIV was in 1985. But that patient, for some reason, I happened to have been in the neighborhood of this case.
China?
No. The first case that we diagnosed in 1985, yes, HIV.
Or you're talking about HIV,
yes.
yes.
So I happen to be in the neighborhood. But any standard HIV patient, if they get HIV today, they can stay 8 years. They can stay 10 years. Some of them can stay longer.
Without knowing?
Without knowing.
Okay.
Or without having symptoms.
Okay.
Whereas coronavirus, it's very rapid, and the symptoms, what we call the incubation.
What are the major symptoms? 3 major symptoms.
The first major symptom is no symptoms. The second one...
The first major symptom is
no
that
symptoms.
there is no symptom.
The second one is no symptoms. The third one is no symptoms. I wanted to mention this because some of the Malawians don't seem to believe that coronavirus is here, because 85% of our people don't have symptoms. So how? But you've diagnosed this person as, yes, but no symptoms. So that's where the denial is.
Okay.
No symptoms.
Okay.
85%. So I said,
so you
no
test,
symptoms.
You
test is positive.
Okay, you test, for example, for the first time, is positive.
Yes.
And there are no symptoms.
No symptoms. And that's the majority of our patients. 85%.
They are probably walking around the country.
around. There will be an update today, but of the 43 cases that were recorded, by the time that we're having this, about maybe 40 of those would be asymptomatic, no symptoms. That's why people still think that we are making it up.
Okay.
And that's across the globe. That's across the globe, that most of our patients are asymptomatic, no symptoms. 10% would be 10 to 15% would have some symptoms. And in terms of those 10-15%, they'll have a sore throat, a little bit of fever, general body pains. In fact, some of them may feel like, in Malawi we could say, I'm feeling like malaria, malungo. It's because they're having a viral infection like a flu, chimfine. So they'll have sore throat, chimfine type symptoms. They may have a cough. But that will be 10 to 15%. And then there's a small group, maybe 5%, that will be very critical. A small percentage would be very critical, and those would even require ICU. But why is it important? It's because of the numbers. Because 5% of 100 is 5.
Okay.
5% of a million is probably 500,000. So because it's highly infectious, because the coronavirus is highly infectious, so the numbers easily go up. So any percentage is also bigger numbers.
Okay. Can you confirm with us that others are recovering?
Yes.
But why are you not telling us?
No, we are. If you look
the recovery reports are not being blown out.
No. In fact,
what is being blown out is, we have reached 35, or we have reached 40. And it's alarming when you hear those stories. What about those that are recovered? Are there any persons that are recovered?
Persons, by yesterday we had 9
recoveries.
Remember, our first case in Malawi was diagnosed on 2nd April. So today is what? Today is 9th. 9th of May. So that's just over a month. Because people in Malawi need to remember this. That our first case was confirmed on 2nd April. That's when the president made that announcement, breaking that we had our first case. So within a month, we've recorded this number of patients. Now, if you look at that, then you're saying that if we had the patient on 2nd April, on 16th April, that patient would have clocked 14 days. And on that date, we will repeat the test.
Okay.
Once we repeat the test, we say, okay, right, we find it. Is it positive? If it's still positive, that has not been cured. If it is negative, we repeat the repeat. So we do 2 tests.
Okay.
Say, at day 14 or 15, do the first test. Day 16 or 17, repeat. So if it is negative, please just make sure that there's an interval to do a repeat test to ensure that.
Dr.
it's
Namarika,
really-
why are we having politicians in front of this fight against COVID-19? Isn't it proper, in your opinion, to put people like you, doctors, in front of this fight? Why are we having politicians?
Political commitment is important in every sector of the economy. I've challenged people when some of the members of parliament come back to me and say, you've not provided us an ambulance to our constituency. Then I say, but you passed the budget. Who passes the budget? Parliament. What did you look at in the budget? Did you put... there are times that we as ministry would have said, we put ambulances there. And our members of parliament did not pay attention to that. I said, no, please include it. And what would be fronted? Maybe a constituency development fund.
Yeah.
But what is your major issue in your constituency? Health. Because that's what troubles the MP every day.
Yeah.
It's health. That troubles the MP every day. And that's why some of the MPs have been complaining that but why we're getting our own ambulance. No. You shouldn't have been doing that. If you really saw that you are as important in making sure that the sector that troubles you most is attended to. So political commitment is critical. Now, globally, what has happened on coronavirus? You see that in every country, what is fronting coronavirus? There's a political face, and behind that political face, there's a technical part. Let me give you an example of the United States of America. For the first time that I noted that when Donald Trump is giving a statement, at least in the first few weeks of the coronavirus in the United States of America, when Donald Trump gets to the podium, behind him are technical people. And for the first time, what I saw...
And there are no technical people when President Mutharika is speaking. He's all alone. With the Minister of Health sometimes.
No, the President has not made a statement with the minute. Maybe it's only during the
lockdown.
The lockdown.
Yeah.
But what has happened is the issue is for us also to say, what is it that we need to protect?
You have just given me the example of President Donald Trump. Every time he has appeared on Corona, there is a technical guy beside him, a doctor.
The statement that
we haven't seen that with President Mutharika.
The statement that the president is making
is
not informed by State House.
Yeah, but why can't you stand or sit beside him? You are the technical person. You are the doctor. You are the PS for the most important and influential minister.
The challenge now that we have to manage. In fact, while we're there, I think we'll talk about the elections issue.
Yeah.
Because we are saying here how much physical distance needs to be there. Has the nature of press conferences changed? Or are we still maintaining the same way we're doing press conferences?
Is that the excuse that you're going to give me why President Mutharika is not flanked with experts?
Have you seen what is happening in the United Kingdom?
Yeah, but do you want
no, but have you seen what is happening in the United Kingdom?
Do you want to answer the Donald Trump element that you brought it? And I'm bringing it back to you.
Yes.
To say Donald Trump, when he's appearing in public, talking about Corona, he has experts beside him. And sometimes he says, expert A, please come and comment on this.
Yes.
Why can't President Mutharika do the same?
No, I think it's not like you cut and paste. In fact, that's where we've said about coronavirus. Which issues should be adopted? Which issues should be adapted? It's not everything fits all. That's why I was giving you the example of the United. Have you seen the United Kingdom, how they're doing the presses?
Yeah,
it's different.
They are doing it
it's different.
Online sometimes.
Exactly.
Yeah.
But it's different. Have you seen how Ramaphosa is doing them?
Yeah.
Is he fronted immediately by technical people? No.
What about reports, not you, but the politicians in front of this fight? They have been accused of using corona to run away from elections, or using corona for political reasons.
But did you see what happened when the papers were being handed over to Malawi Electoral Commission?
I saw people shoulder to shoulder.
Was that a concern? Was that a concern? Do we really want to go that route? Do we really want to go that route?
Yeah, what are you telling us?
I've been to Center for Multi-Party Democracy, and I've said it. There's a risk here, unless we're sure that we'll manage this. But as you can see, it's not easy.
South Korea had elections amidst COVID. How did they do it?
That's why I'm saying that, are you sure that what is happening in South Korea is possible to happen here? What is the voting process in South Korea? Do people queue, or can people vote online? Do you know that South Korea is running a 5G system now, one of the fastest across country? Is it something that is possible in Malawi? What is that? What are the literacy levels of people in South Korea versus Malawi? What is the testing system in South Korea versus Malawi? So we cannot just say because it has worked in South Korea, this will work in Malawi. We need to know our people, we need to know our context.
Dr. Dan Namarika, allow me to take a short break. We'll be back with you in a moment.
Thank you.
In case you're just joining us, this is Times exclusive, airing on TTV. I'm joined by Dr. Dan Namarika, our Principal Secretary in the Ministry of Health. We'll take a short break. We'll be back in a moment.
I love brilliant green on my walls. I love signal red, sweet lime, electric blue. I just love golden yellow.
You get all that and more at Rainbow Paints. Imagine a water-based paint that is water resistant. Imagine a paint that is absolutely washable to remove dirt. And it guarantees you 10,000 cleaning scrubs over its lifespan without losing its luster. There can only be one paint that does just that, and that paint is acrylic sheen. Get yours today at all leading hardware stores. Rainbow Paints. Peace of mind. Part of the deal.
You are watching Times exclusive on TTV. My name is Banda. Glad that you could join us tonight. We are in the second half and the last half of our discussion tonight. I'm joined by Dr. Dan Namarika, Principal Secretary in the Ministry of Health. Welcome back to the other half of the program.
Thank you very much.
Now, you reminded us what happened in Blantyre, where the nomination of papers was taking place, shoulder to shoulder, candidates going into cities and townships. How should we handle COVID amidst the campaign?
I think the first thing is that we need to remember that coronavirus is real. Today now Malawi has 56 cases confirmed. Only yesterday we had an additional 13 cases added to the 40.
Today, actually.
Today. Added. Yes, they were confirmed by yesterday. So of course the announcement was made today. So we got 13, and those 13 cases we also need to track their contacts. So it's quite some work. So the issue is real, that coronavirus is there. What may be cheating, as I said earlier on, is that people don't have symptoms, and they may come to the rally without symptoms.
So should people go and attend political rallies? Would you recommend, Dr. Namarika?
It is a big compromise. Honestly speaking, it is a big compromise. And if you are following up the World Health Organization predictions, they're saying that Around June, July, that's when Africa may be having its effect. What was effect? Remember that what we've noted with the coronavirus is that it is moving, it's what we call migrating. China, then it went into Europe, then America. The current numbers in Brazil or South America are quite a concern.
What is the relationship between corona and the high temperatures? Because I am told that if you are warm enough, you might be protected.
No relationship.
No relationship?
That is not true. That is not true. Remember that if you're looking at temperature, geographically we have the equator. Might be the hottest area. It's around the equator. In the north, 23 degrees, we have Tropic of Cancer. In the south, we have Tropic of Capricorn. Look at Italy. Is it in the tropics? Probably the southern part of Italy is tropical. Do they have cases? Huge number of deaths. The Americas. America has both the temperate, very high north, but in the southern part is more or less tropical climate. What is happening in Cuba? Cuba is probably around between the equator.
Tell us what is happening in Cuba.
Numbers are also going up.
How many deaths?
I may not tell you the actual deaths, but Brazil, which is on the equator, there are not less than 600 deaths now, almost every day.
600 deaths so, every day?
So it's nothing to do with weather. In fact, those were myths.
What about reports that are saying it may be worse in the cold season, May, June, July?
When people are looking at coronavirus, they're taking coronavirus, the new one, what they're calling COVID-19, comparing it with other types of coronaviruses, which also present with similar symptoms.
There are other coronaviruses?
Yes.
Okay.
There are other coronaviruses that present with similar symptoms. And what has been noted on those coronaviruses is that there might be a seasonal pattern. But this one, the new one, doesn't seem to be following that pattern. There was even mention, you remember, that blacks are not getting affected. But if you go to the United States of America, blacks are the hardest hit. And the reason, yes,
yeah, the reports that we got today, 5 health workers,
yes,
positive.
Yes.
What are we doing with PPEs?
No, PPEs very critical, very critical.
These are health workers. It means that they are susceptible to get it.
They are indeed. In fact, they are frontline. They're frontline people.
Are they protected enough? Are they protected enough if they are at risk?
So if you look at, in fact, when we were looking at the numbers, those that have been affected, we have a few that are lab. So when we analyze this, are they really, when they're going into the service, are they being donned or dressed rightly? I said yes, they're always dressed rightly. But the nature of the job is that it's still a high risk profession. Yeah. When you look at our system here in Malawi, we can't, like in China, they would, within a week they've constructed a hospital.
Yeah.
It takes us 2 years to construct a hospital because either funding, all these issues,
bureaucracies and stuff.
It might be. So when you're looking at strengths of but you go to ride on the strength of a particular country, and our strength in Malawi is prevention. Immediately we have 100, 500 people, 1,000 people requiring ICU services. We can't cope.
Why are the borders? I still ask this question until today. Most of the cases you hear, they are from Tanzania or abroad, outside the country. Why are the borders still open today, Dr. Namarika?
No, the borders have closed. The numbers have reduced.
The borders have closed?
They've closed. We have 3 borders that are still open. There's the Songwe, Mchinji, and Mwanza.
Why is the Songwe still open?
But the opening is not to any traffic.
Okay.
So there's control. Basically, we are encouraging only movement of essential goods. But what we've noted is that there are some goods that are not necessarily essential. Of course, one would say essential to whom? Essential to whom? But government has defined what essential commodities are that need to move. For example, we need fuel, and Malawi doesn't make its own fuel. So that would be an essential commodity. We need medicines. By the way, we have one of our set of medicines at central medical stores out of stock, because our ship, one of our ship is the ship that is transporting our medicines to central medical stores, has been locked in Beira. So the whole ship, whoever the crew, they will not get board off the medicines for 2 weeks. So they are at Beira, and that has affected. So we still need some commodities, some goods
in
to come into
the
country.
beginning of
The question would be
yes,
how we manage it. For example, if one is buying a vehicle that you already ordered 2-3 months ago, before the coronavirus, you ordered from Japan, and it is arriving at the port in Dar es Salaam. The longer you take, the more you pay. How should we start managing those?
That's right.
So I think those ordered earlier. So the issue should be, what are the ways we can get? Because someone can transport that to the border at Songwe.
We seem to run out of time, but I cannot let you go. The next few questions are very personal and very important to our viewers. I did ask you in the beginning of the program, you seem to have risen the ladder of leadership pretty fast. And you answered me that it was by God's grace. But others have said that it's because you are connected politically to the establishment. Dr. Namarika, are you in any way connected politically?
A very good question, and I'm happy that you've asked it. That connection to the... In fact, people... Let me just... There was a time that I was doing a ward round at Kamo Central Hospital. And one of the nurses called and said, I'm looking for Dr. Namarika. Then there was a police officer that came. I said, who is saying Dr. Mutarika? Then they called me and said, no, I am Dr. Namarika, not Mutarika. It happened, it's real. In 4A, I actually remember that. So people, because of the names, they think that, and the fact that I worked and saved Bingwa Mutarika, how did it happen that I saved Professor Bingwa Mutarika? You know what happened? I was amazed because at Ministry of Health during that time, the PS was Mr. Kangombe. Then he called me this day and said, Dr. Namarika, we need your CV urgently, your curriculum vitae. Then I said, right, I'm giving my CV. I didn't know where it was going. And it took maybe 3 months. In fact, I didn't pay attention to that. Maybe 3 months, and then I got a call from State House during Bingo's time. Said, no, the president has seen your CV and is happy with your CV. I never knew Bingo Mutarika.
What about our sessions?
He looked at my CV. And the call was from Mr. Kangombe, PS Health at that time. So and I was seconded to State House.
What about the assertion that people make quite often that you are related to the Mutarikas, including the current president?
No relation at all. Literally no relation.
People actually say ndamalume wanu.
No relation at all.
No relation at all?
Literally no relation. No relation at all. Literally no. The issue is, I think people think Mutarika, Namarika. And of course I worked for Bingo.
So you are from Cholo?
I'm from Cholo.
Okay. So is it because you're from Cholo that you are
it's a
PS of Health today? And that your promotion was fast-tracked because you are a Lomwe?
No. In fact, you know, the president had a choice to put anyone. Let me tell you this that happened to me. After I moved out of State House during Bingo's time, in fact, when I was going to State House, I was already grade P4, because I was already a specialist. that is during Bingu or Mutarika's time. I was already a P4, and I had been promoted to P2. When I moved out of State House, I was demoted back to P4.
Why?
I wasn't given a house. Myself and my wife, both I'm a specialist. My wife is a doctor, quite senior. My wife at that time was already P4. Now she's P2, like a few other. So she's quite senior. But despite that, we struggled to even get a house, which we finally did. But I was demoted. And I'm not sure how many doctors have been demoted.
Why were you demoted?
I don't know. And I got a couple months without a pay. Bingu died. Then I went back to Kamo Central Hospital because it was a secondment.
Yeah.
So I needed to go back to my base. But I went months without my salary. And then because of that, I said, no, but I can't survive like this. I moved out of government. I joined Partners in Hope. I joined Partners in Hope as a physician. And within 3 years, in the second year, I was promoted to the medical director at Partners in Hope. In the third year, I was promoted to chief executive of Partners in Hope. I was overseeing Partners in Hope. And before even I went to Partners in Hope, I was earmarked to lead the Young Local Hospital.
So why did you come back to government?
You know what my salary was at Partners in Hope? 3-4 times what I'm earning in government.
Yeah, so why did you come back?
Save Malawians.
It's because...
You know what Bingu told me?
It's because the establishment
Bingu told
asked
me,
you to come back to help them.
Bingu told me, when I was with him, he said, Dan, because we had traveled, I think, to Spain some other time. So someone said, I want to take you. Someone in Spain while Bingu was there. So there was myself, this gentleman. So he said, why don't you want to stay here? Bingu said, he said, I will not allow you, Dan. If immediately you do that, I'll snatch your passport. I want you to save Malawi.
So it was not Mutarika who said come back to the civil service?
It was the chief secretary.
Okay.
That called me. Why don't you come back to government? When he told me to come back he told me around December of 2016.
Mm-hmm.
You know how long it took me to accept that? 3 months.
Okay, so can you confirm that your promotions were fast track?
No, they were not.
You are a PS today. Within the shortest.
They are not fast.
The shortest.
They're not fast
amount of time.
I was already P2. I was already P2 when I was in government. I was already P2. So I'm not sure what is the grade of a PS. It's P2.
So you don't have any political connections,
Actually,
and you haven't benefited Dr. Namarika from any political connections?
I'm saying that. Peter, the president,
yes.
He said, I feel we're doing a disadvantage to you. Because I know what you're earning there. You're earning much more than what you'll be earning in government. And I told the chief secretary, in fact, when I got my first pay slip, I told the chief secretary, my children were being supported, the medical insurance, my entire family. So government doesn't provide me that.
Is that the norm, that the chief secretary can call someone just to come and join the civil service?
It's not the only one. You remember the former ST, Mangan, who was at Chancellor College?
Mm-hmm.
How did he come back to government?
Without interviews, nothing?
How did he come? Ask Mr. Mangan. Is it Dr. Mangan?
Yeah, I'm just asking
It
you.
is.
I'm just asking, is it normal for the chief secretary just to call someone to come and get employment?
All grades above P2 don't go through interviews.
Okay.
All grades about all these doctors that we are promoting to P4, they don't go through interviews.
Is that how it should be?
That's a different story.
Yeah, my question is,
it's not unique.
Is that
but
how
that's
it
not
should
unique.
be?
No, it's not unique to me. The issue is at the current state. That is the process.
No, I'm asking you.
But everywhere, if you go to most governments, there are executive powers
that
are enshrined into that.
So why were you picked Was it?
No, I do not know.
You don't know?
I do not know. But the issue is, did I feel like I can serve? I said yes, I can
So
serve.
it was not because you are a Lomwe that you were picked?
No.
It was not because you are connected with which you are
The issue
refuting?
is, what is wrong with being a long way?
No, because the current administration,
What is being-
the current administration is being accused of being nepotistic, and that's why I'm raising this issue.
But are you saying that long ways are not competent?
Hearing you talk tonight and the
Are
the
you
way
saying
of
that? Are
explaining-
you saying that long ways are not competent?
No, here-
How many long ways should I tick and say, one on one, match it? Let me go back.
Where I have a problem,
Yes.
Dr. Namarika, is when the chief secretary just calls people and say, come and start work here. I find that
No. It's firstly, I was working in government.
Okay.
I am a professional. So he says, Dan, are you ready to save us?
Mm.
I said, no. I took 3 months. Wait a minute.
Mm.
I said, no, Chief Secretary, are you saying that I will sacrifice this, that? I said, he allowed me 3 months. 3 months to say, think about it.
Let's talk about your stay at State House. I don't like talking about death, but we lost the president when you were his physician. Others have accused you that you did not tell the nation the truth. Why should we trust you today?
What normally happens in death, if you're in a clinic, do you go to the employer or you go to the next of kin?
You are a doctor, you should know better. Where
No,
do
but
you
what
go?
is the process?
Where do you go?
If you die, you go to the next of kin.
Okay.
But let's also look at things within Malawi,
Yeah.
because this is now outside medicine.
Yeah.
So the first person you call, you talk to, is next of kin.
Okay.
It's up to the next of kin to tell their uncle, to tell whatever, this has happened. So the person you tell is next of kin, and for a doctor, you stop at that,
Okay.
as far as Malawi is concerned. Then the next thing that any Malawian would understand is that, generally speaking, and I'm not talking specifically, a death of a king is not handled the same way even in our villages. But that was not my part.
Okay.
That was not my part. My part is to say, here we are, the process will have to take off. So that was my...
So as a
my
doctor,
responsibility.
you did the right thing. When you look back, do you have any regrets? Or you could have done better?
Very good question.
Yeah.
Extreme regret. In fact, I've thought about it many times. You know what gives me energy?
Mhm.
Is I say, if I were to repeat that, would I have made a different decision? And I've always convinced myself I made the right decision.
As I said, we are talking of...
I made, in fact,
Yeah.
that's where I say to me, you remember that I said my dad told me that you're a Joseph?
Mhm.
That's when I said, oh, all right, I think that's what my dad was meaning. And you know, the person that encouraged me during that time, among everyone else, was my wife.
Did we send Bingu alive or dead to South Africa? I'll finish on that note. I don't want to get further on that one because we're talking of a person who died here and their emotions, probably relatives are watching us.
No,
We want to clear that because
No, that
that keeps
one-
on coming. That keeps on coming.
You know that. You know what?
Yeah.
I had been asked to write up a couple of times.
Yeah.
I will not say some of the things here that I went through.
Yeah.
Years after that death, where the police had to come and get a couple of statements from me, and
Yeah.
sometimes trying to force me to write things.
Okay. The police forced you to write
Yes.
this?
Because they didn't believe what I wrote.
Okay.
Yes.
So do you want to answer my question?
No, this one I will not answer because this happened again. It happened a couple of times. So this one I will not. As I said,
Why are you having Why are you having difficulties in answering this very important question?
No, it's very important. But my role was to inform the family that this is a state, and then the machinery will take over.
We have to leave it there.
Thank you.
I respect your right to reply, and I do appreciate that. Let's quickly come back to the Minister of Health. Are you happy with what you are doing there? When we hear of hospitals having challenges of medicine, PPEs as we talked about, and when are we building more hospitals? We'll finish on that note tonight.
My principle has been, you got to say, what is it that I'm in control of, and I can improve on. That's the first thing. The second thing is to say, where am I coming from? I've been in the ministry now 3 years.
Yeah.
And so I would say to myself, where did I find the ministry 3 years ago? If I was in a parastatal, the board of trustees would have assessed me.
Yeah.
They would have assessed me and said, this is what you've done in the past 3 years. Should we renew your contract, or you need to set aside, step aside because you're not performing.
Yeah.
Unfortunately, of course, but that's what I would have wanted to say. Assess me.
Yeah.
During the 3 years that I've been there, if I was chairing.
Do you think you are doing a good job?
I think I've contributed. I think I've contributed. I may not have solved all the problems because some of them are short-term, medium-term, long-term. The issue is for the short-term, did I manage them? If I did, fine and good. The medium-term, what was my plan? For the long-term, what platform do I leave for the next person who comes after me?
When are you leaving?
In fact, one thing I've thought about, my dad, I said, is a pastor. My grandfather was also chairman of the synod, Nyasa Mission. And so I've always said, I don't think I need to get to 60 and retire at 60. I think I can retire earlier than that. But I've just been thinking, what do I want to be doing?
You still have more years at the ministry?
Well, I'm still young.
Yeah, I'm saying, is your contract?
No, it's not on contract.
Oh, it's not on contract.
I'm permanent.
Okay.
I'm permanent.
Okay.
So I can move out of ministry, go back to Central Hospital. In fact, I enjoy patient care more than this job.
When you see patients sleeping on the floor, how do you feel?
No,
not as a doctor, but now as a decision maker, as the principal secretary.
No, I get concerned. I get concerned. The question for me is, if I had 15% of patients sleeping on the floor, am I still maintaining 15% on the floor? Or am I moving to 7%? Am I moving to 5%? Am I moving to 2%?
COVID money, are we managing it very well?
Another good question. Most of the COVID money on the health cluster is donor money, managed by the donors. Maybe 85-90%. The only money that we got in the health cluster was 2.4 billion. And I'll tell you how we distributed it. 2.4 billion, about 1.1 billion was given to all councils. Directly sent to all councils, 1.1 billion.
To do what?
For their operations. Because where is COVID? It's in the districts. That's where we got cases in Banda. That's why we got cases in Mangochi. They need to prepare. So we gave them a tranche 1.1 billion out of the 2.4 billion. Because that's the money that we are responsible.
Yeah.
The rest is donor money. In fact, most of the procurements, I mentioned it, is through UNICEF. It's not government. It's not central medical stores.
So what was...
Let me finish.
Yeah.
Then I talked about 1.1 billion. 700 million. Malawi Defense Force, police, immigration, because they are supporting us. All these uncharted routes, it's the police. And honestly speaking, we need to appreciate what the police, immigration, and the MDF are doing in the COVID response. Then the remaining money, there's money for distribution of PPEs and then there's money for coordination. Now, the issue around allowances, was it? Allowances for the...
Yeah, that was my next question.
Yes.
What was Minister Bodomani whispering to Minister of Health?
No, I'm not sure what they were specifically referring to in that clip. But let me just tell you what the procedure is.
Yeah.
They've done a few trips out as ministers to look at the preparedness. Maybe they've done 4 trips. The first 3, they've not received any allowances.
Okay.
And you can go to a ministry and check with any accounts. Those people, in fact, we owe them money. Owing in the sense that they needed fuel. They needed to sleep somewhere. And what are the rates? Now, the last trip that people were making, what that was on the air, was the very last trip. And in that trip, if you noticed, there were also members of parliament that are in the parliamentary committees. Because we are saying here, this is not only an executive arm of government issue. Parliament needs to be engaged. The rates for the ministers, when they go out, either they go on full board, which you are aware, the minister can say, all right, I'll sleep at the hotel, which means the ministry pays the hotel, no allowances to the minister. If the minister chooses or the MP chooses not to receive, the rates are 70,000.
Unfortunately, we don't have much time. We wish we had more time. So you're not giving allowances to ministers who are already salaried?
No.
And saving in their ministry?
No, they don't. Zero. In fact, zero allowances. Zero allowances. Only if they're going on a field, then they'll go on a standard conditions. If they're being sponsored by donors, in fact, donor money rates are even lower.
Okay.
Government rates for ministers were 70,000 kwacha per night for 2 nights. MPs 60,000 kwacha for 2 nights. Because they're getting out of there in Lilongwe, they're going to Sanji. So this was not true.
Are we safe? Is our health system in safe hands? Can we fight these challenges facing the health sector as the UK are fighting, or we are in trouble? Dr. Namarika.
The coronavirus has tested resilience of even what we thought were resilient systems. If in US you're having 70,000 deaths with all what is at their disposal, that's why I said our strength is in prevention.
Dr. Dan Namarika, Principal Secretary in the Ministry of Health. Quite interesting hearing you talk tonight. We wish we had more time. Thank you very much for joining us.
No, thank you very much for inviting me.
Well, on that note, we wrap up this week's edition of the program Times Exclusive. In this edition of the program, I was joined by Dr. Dan Namarika, Principal Secretary in the Ministry of Health. My name is Brian Banda. If you have any comment on what we have discussed tonight, we in Times Exclusive would love to hear from you. Drop us an email, brianbanda@bnltimes.com. brianbanda@bnltimes.com. From all of us here at Times headquarters in Blantyre, thanking you for joining us tonight, and see you next week. Goodbye.